You know, 1 in 5 people will develop skin cancer by the age of 70. And now doctors are reporting an uptick in advanced stage diagnosis of melanoma, possibly linked to patients delaying checkups during the pandemic. Well, it's May 1st after all, is Skin Cancer Awareness Month. And here to share some helpful advice, dermatologic surgeon Dr. Hugh Greenway from Scripps, MD Anderson Cancer Center and Scripps Clinic. Thanks so much for coming in, doctor. Really appreciate your time. Here, we are in May gray. Right, today we're starting off great, but don't let that fool you, folks. Still lather on that sunscreen, right?
Right. We're in May, and May the 1st is Melanoma Monday. Melanomas come as black moles that we see, but certainly with the overcast, we can have a sense of feeling that we're more protected than we are.
Sure.
Because you can get the UV rays through the clouds, so we need our protection all the time.
Now, is it true that it's harder to get through, or it comes through quicker because it's trying to get through the clouds? And what's the backstory on that?
It depends on the cloud cover and how thick you are, but the UV rays do come through the clouds.
Yeah.
The UVB and the UVA, and can damage our skin. So you do need protection even when the sun's not out.
Okay, what should people be looking out for? Today is a good day, a good reminder, Melanoma Monday here, to look around, check your body, or have an expert do it.
Yeah, what we encourage people, especially here in San Diego, we love being outdoors. That's one reason we all live here.
Absolutely, yeah.
Our kids play baseball, we go to the beach, we play golf, tennis, pickleball, all that stuff. So we love being outdoors, which is great, but you've got to protect yourself. You need to be checked by your doctor once a year.
Okay, once a year. Okay,
if you've had melanoma, or are higher at risk, then maybe more often. We see melanoma in the skin as a black mole. We can also see melanoma of the eye.
Okay, wow.
I have a sister that had melanoma of her eye. The eye had to be removed.
Okay.
But if you'll be checked once a year, unless you're at higher risk, by your family physician or your dermatologist. Now, we all have a lot of moles. Most of us have 20 to 40.
Okay, yeah. I think I'd probably double that.
Yeah, okay, you fit in that category.
My kids remind me of that,
yeah,
yes.
Okay. Half of melanomas start out as a melanoma, as a black spot, a dark spot.
Yeah.
The other half of melanomas come from a normal mole that has changed over the years, probably because you had sunburns as a younger person.
Sure.
If you've had 3 or 4 sunburns as a younger person, that increases your risk of having melanoma.
Oh, wow, okay.
So that's one reason we like protection, because first of all, you don't want any wrinkles on your face.
Right.
And, you know, the sun contributes to that, but also you don't want skin cancer. 1 out of 5 Americans are going to get skin cancer, and you especially don't want melanoma.
Okay, so we can lather on the sunscreen, but hey, wear a cool looking hat. Hey, Joe Musgrove bought the bucket hat back, right? I mean, and that'll help out a little bit, right?
Yeah, well, we know we got, baseball hats, wide brim hats. Baseball caps don't protect your ears. So you really need a wide brim hat.
Okay.
And a lot of it's common sense. Okay, if you have a chance to stand in the shade when you're playing golf or something, go over and walk in the shade for a couple of minutes. Wear a wide brim hat, and then sunscreens are very important.
Yep.
You need a couple of ideas when you're thinking about a sunscreen. Number 1, it needs to be broad spectrum.
Broad spectrum.
So it has to have protection from UVA and UVB. Okay. The B is the number on the front.
Gotcha.
You need a 30 to a 50.
30 to 50.
You can buy more than that. We have a problem in America. If a little bit's good, a whole lot's better, right?
1,000 SPF.
The higher ones are great, but more expensive. So a 30 to 50 is fine.
Okay, good.
A broad spectrum, and then you need to reapply it after a couple hours if you're out because of the wind, the weather type sort of thing. Okay. And you need one that's kind of water resistant, we say. Now, they come all sorts of ways. They come in creams, lotions, sprays, sticks, things for your lips. We used to say the sprays were not as good. Yeah. But they are now.
Okay, good.
The best sunscreen is the one you wear.
Yeah, that's right. Yeah, just get something on there.
So that's why I tell people with your kids, take them to the drugstore, let them pick the sunscreen they want within the parameters.
Doctor, we only got about 30 seconds left, but I just want you to touch on the tanning booths and how destructive those can be.
The worst thing you can do for your skin is to have a membership at a tanning booth. Here in California, we've outlawed them without parental permission for teenagers. So if you're going to go and you say, I need a little color for a picture in a wedding, fine, but do not buy a membership in a tanning booth. Worst thing you can do.
Yeah, I mean, we live in a very sunny area already, don't we? So yes, make sure we protect ourselves. Doctor, where can people go to learn more?
You can go, there's several big websites. Scripps has a website, so scripps.org. The American Academy of Dermatology, AAD.org, are both really good resources to learn more.
Get your sunscreen on, get your hat on, and don't let those clouds fool you, right, Doctor? Okay, thanks so much for coming in. Really appreciate your time.
Thank you.
Stay safe out there, everyone. We're taking